Hi there! Welcome to our guided tour of Medicare. When it comes to your health, what you want is simple: to feel the best you can as often as you can. So you want a plan that helps care for you every day in all sorts of ways, including caring for your budget. That's why it helps to understand what kind of plan you need and how to make the most of it. We'll help you learn everything you need to know about Medicare, what it covers, what options you have, and when to enroll. So when the time comes, you're ready. So let's start with when you're eligible to enroll in Medicare. You are eligible if you are turning or have turned 65, even if you still work, or you're under 65 and have a qualifying disability or end-stage renal disease, and you're a U.S. citizen or a legal resident who's lived in the U.S. or Puerto Rico for at least 5 consecutive years. Maybe you're enrolling for the first time, like Susan. If so, the initial enrollment period, or IEP, begins 3 months before you turn 65 and ends 3 months after, which gives you 7 months to enroll. Susan's birthday is on the 1st of the month, so her enrollment period will begin and end a month earlier. Want to add, drop, or switch your Medicare coverage? You can do it during the annual election period, also known as AEP, October 15th through December 7th. Then there's the open enrollment period, or OEP, which runs January 1st through March 31st. If you already have a Medicare Advantage plan, you can change your plan during the OEP. James used this time to enroll in another Medicare Advantage plan, whereas Lisa decided to go back to original Medicare during open enrollment. You may only make one change within the period. Certain life events may qualify you for a special enrollment period, or SEP. These are times outside the other enrollment periods where you can enroll in, drop, or change your plan, depending on your eligibility. For example, Jeff recently lost the coverage he had through his employer this month, so he has 2 full months after the event to enroll through the special enrollment period. Specific dates vary for each person's situation. Now that you know when you may be eligible to enroll, let's lay out the 2 steps to help you get started with Medicare. Step 1 is to enroll in Original Medicare, offered by the federal government. Original Medicare includes Part A and Part B. Part A helps pay for hospital stays and inpatient care, while Part B helps pay for doctor visits and outpatient care. It may also help pay for services like occupational and physical therapy. However, Original Medicare doesn't cover everything. Benefits like long-term care, dental, vision, and hearing coverage, and most prescription drugs aren't included. Step 2 is determining if you need the additional coverage we just mentioned, and if enrolling in a plan through a private insurance company makes sense. When it comes to additional coverage, you have a couple different options. Kim decided to enroll in Medicare Part C, also called a Medicare Advantage plan. With this plan, Kim will get everything Original Medicare covers plus additional benefits. You can also get a Medicare Advantage plan that includes prescription drug coverage, known as a Medicare Advantage Prescription Drug, or MAPD plan. For Michael, the best option was to keep his original Medicare and add prescription drug coverage, also called Part D. With Part D, each plan has a list of drugs it covers, called a formulary. Tier 1 covers preferred generic drugs. Tier 2 covers generic drugs. Tier 3 covers preferred brand name drugs. Tier 4 covers non-preferred drugs. And Tier 5 covers specialty drugs. Additionally, certain plans may offer a 6th tier. In most cases, the higher the tier, the higher your out-of-pocket cost will be. Please refer to the Summary of Benefits and Coverage for more information. Most plans have 3 stages for covered Part D prescription drugs. Once Michael meets his deductible and reaches his out-of-pocket cap, his plan will pay the full cost of covered Part D drugs. If you want to add more than just drug coverage to Original Medicare, you can add a Medicare Supplement insurance plan like Linda. Medicare Supplement plans can be added in addition to your drug coverage or by itself to Original Medicare. Linda chose to add this plan to help pay for her deductibles, co-pays, and other costs Original Medicare doesn't pay for. Lastly, there are 3 types of special needs plans that may be available to you depending on your area and whether you qualify. The first is the Dual Eligible Special Needs Plan, or DSNP, which is for those who qualify for Medicare and Medicaid, like Robert. These plans may have benefits that go above and beyond Robert's regular Medicaid coverage, such as enhanced care management. Next is the Chronic Condition Special Needs Plan, or CSNP. This is a plan that may offer added benefits for people with an eligible chronic condition, like diabetes or congestive heart failure. Finally, an Institutional Special Needs Plan, or ISNP, makes sense for Stephen, who requires institutional level care and has stayed over 90 days in a long-term care facility this year. If you think you may need help covering your drugs, you may qualify for Extra Help, also called the Low Income Subsidy. It is a government program to help people who qualify pay for their prescription drug costs. Now you're ready to look at plans. When you do, ask yourself a few questions, such as, how much will my annual premium be? My deductible? What about copays? Will I get drug coverage or other additional benefits? Which doctors, hospitals, and pharmacies can I go to? Does it offer convenience, like prescriptions delivered by mail? Does the plan cover a chronic condition I have to manage? And finally, you'll want to consider what medical care you may need down the road. That's it. Now you know when to sign up, your options, the extra coverage that may be available to you, and even the things to consider when choosing a plan. To learn more, check out humana.com/Medicare 101.